If you've ever seen someone with a thick white tongue coat and thought, that looks nasty, this might be someone with Candida or a fungal issue. Now, I'll never forget the time that I first was very, very sick with a flu, and I went into the mirror and stuck out my tongue and looked at the thick white tongue coat that was going on. And I was wondering, what is this that is going on in my body here? And it wasn't until years later when I began studying traditional Chinese medicine that I learned what this white tongue coat means and what it can or may not reflect about Candida and yeast or bacterial issues going on in the body. Now in this video, we're discussing Candida, East and West, and what helps it the most. Hey guys, I'm Dr. Alex Hein, Doctor of Acupuncture and Traditional Chinese Medicine, and author of the health book Master the Day. So let's jump in. Now, first of all, what is Candida? Candida is a type of fungus. Now, there are many different kinds of species of Candida, but in one particular research paper here called Candidiasis, Candida is a form of yeast. It most commonly occurs, and this is very important, as a secondary infection in immunocompromised individuals. Now, synonyms of this also include, for example, thrush. They are common inhabitants in the oral cavity, so you may see like a thick white tongue coat. The gastrointestinal tract, people often come in with severe bloating and distension. The vagina, the penis, or other parts of the body. So some women may, for example, have discharge, yeast issues that are gynecological in nature. Now, candidiasis affecting the mouth is commonly called thrush, and it shows up as white patches on the tongue, throat, or other mouth areas. Now, in addition, soreness and difficulty in swallowing include other symptoms associated with thrush, and like for many women that come in, the vagina when affected by Candida is called a yeast infection. So that is what Candida is in a nutshell. Most commonly, it is opportunistic in nature. So there is some susceptibility that then leads to Candida being this full-blown problem in the body. So before we jump into the common signs and symptoms, because there's a lot of misinformation on the internet, let's jump into the main causes of Candida, and then we'll jump into what it actually looks like. So the common causes that lead to the overgrowth of Candida, this overgrowth of yeast. One can be taking antibiotics. I see lots of people, my patients for example, that have chronic sinus infections. They take antibiotics once a season. Sure enough, after a year or two or three, now they have severe GI issues. So you've actually wiped out the ratio of good to bad bacteria. In addition, a diet high in sugar and refined carbs can lead to that overgrowth. So a lot of these bugs in the gut, they love sugars and they love feeding on glucose. High alcohol intake, a weakened immune system, oral contraceptives, diabetes, or high stress levels. Now, what are some of the key signs and symptoms? Obviously, we can break this down to orally in the mouth, in the gut, and even reproductively. So when we talk about in the mouth, white patches on the inner cheeks, tongue, roof of the mouth and throat, redness or soreness, a cotton-like feeling in the mouth, or even loss of taste. When we talk about the gut, most often when I see people come in, they are having issues that look like SIBO, right? Small intestine bacterial overgrowth, severe abdominal distension, bloating, food allergies, sometimes loose stools, sometimes reactions to lots of different foods. But in general, severe bloating is the main cause that is worsened with an increased intake of sugar or starches and is benefited basically by going on a very low carb diet, so that basically the bad gut bacteria cannot feed on these disaccharides that are basically in the food that you're eating. Now, when we talk about Candida, basically in the reproductive system, most often women come in, they say they have a yeast infection, which involves vaginal itching or soreness, sometimes even pain with urination or with sex, or abnormal discharge. Now, how does traditional Chinese medicine view Candida? This is very valuable, and I've actually put together an entire free guide, which is 4 daily rituals that can help you add years to your life and heal with traditional Chinese medicine. It's the first link right below this video. But in general, the reason that I bring this up is because TCM views the body as a system, right? It is never just oral Candida, gut Candida, vaginal yeast, right? It is all one thing. From our point of view, it is a systemic issue. And a lot of the way we think about this is that these issues are called issues related to dampness. Now, conditions that are related to dampness in nature typically involve mucosa. So ear, nose, and throat, the gut, genitourinary systems, right? Because a lot of people who have gut dysbiosis, a lot of women that have yeast issues, Candida, SIBO, bloating, will often have vaginal yeast issues. The milieu, the gut, is very similar in that way with these bacteria. The mucous membranes are really what govern issues related to dampness. Dampness in the gut is very often bloating, especially bloating, distension after meals, getting a food baby, loose stools. Lots of people have low appetite on this. Lots of mucus production, right? People always clearing the throat have issues with dampness. And in general, all of these issues with dampness primarily are focused on for the tie-in organ network, which is the lung and the spleen. So spleen qi deficiency is a common diagnosis you will hear in acupuncture offices. And what that really means is a combination of patterns in the body related to the pancreas function, levels of stomach acid, immune function, and then issues with small intestine absorption. So Candida is an issue with dampness primarily. Now the dampness may be damp cold, or maybe damp heat. And when there's damp heat, there are more issues with itching, fungal bacterial issues, more redness, more color, that kind of thing. One thing I need to comment here is that people who are prone to this are very commonly constitutionally predisposed. We use the word constitution in TCM because a constitution indicates a tendency you have throughout your life. And most of the patients that come into my clinic in Los Angeles, they will come in and they have a tendency towards gut bloating and distension throughout their life. It is a genetic susceptibility or their Achilles heel. So what we have to do is not only treat the symptoms of it, we also have to treat the root, which is this genetic tendency. And the best way in my mind is through the traditional formulas of TCM. So let's talk about what some of those are and what the research says. So how does traditional Chinese medicine treat Candida? Take a look at this one research paper here on an herb called Ho or magnolia. This particular paper is called Antifungal Compounds Against Candida Infections from Traditional Chinese Medicine. And they talked about one of the compounds called magnolol, one of the major pharmacologically active compounds from Magnolia officinalis, which could be used to ameliorate the symptoms such as anxiety, nervous disturbance, and digestive problems. They talk about the compounds from the essential oil of mint, menthol, and even this suppress the growth of Candida albicans, which is one of the species of Candida. Basically, and it talks about how it breaks down the cell membranes and yada, yada, yada. But in general, Magnolia Hopua is interesting, not only from the ancestral traditional medical knowledge as something we use for gut issues, but actually is verified in these biomedical studies. Now, another herb that is very commonly used is called huanglian, which is coptis. Now, coptis in particular is one of the most bitter herbs you will ever taste in a formula if I give it to you. And coptis is bright yellow when you steep it and you decoct it. And that's a result of the berberine in this actual herb. Now, berberine is very trendy these days, but let's look at what the effect is on gut distension and the effect it has on these Candida species. So there's one really neat paper compared different herbs and their effects on different strains of Candida, which is pretty cool. So in particular, huanglian was found to have very, very strong effects on 3 different kinds of Candida that they had studied, way more than the other herbs that they had documented here. Now, these herbs that are extremely bitter are very potent antibacterial, antiviral, antifungal. So what they're actually measuring here is this is the average of the inhibition zone measured in 4 different areas. So basically they're trying to see how well did the huanglian prevent the spread of this, the growth of this. And look at the difference here compared to some of the other herbs above. And one final herb that we use for abdominal distension, shebai or garlic. In this case, in this research paper, which is again on antifungal compounds against Candida infections from TCM, they found that garlic, which has been used as a traditional antimicrobial agent for thousands of years, exerts its antifungal effect through introducing oxidative stress and depleting glutathione. So how do we actually treat Candida clinically? From my point of view, the microbiome is just much more easily approached through herbal therapy than acupuncture therapy. Now, I am taking new patients in my practice in Los Angeles or virtually via telemedicine. You guys can read more about my clinic right below this video, but in general, custom compounded herbal formulas typically taken over a period of 4 to 8 weeks initially and then 3 to 6 months. For people who have long-term chronic SIBO and gut distension and Candida is often a thing that changes the game. But in general, it depends on where you are constitutionally, your genetic tendency, as well as your prior medical history, because you may just be here watching this video because you've had 10 rounds of antibiotics for sinus infections over the last 2 years, and now there's collateral damage. So before you guys go, check out this other related video right here, also on Candida and gut health, because I think that's gonna help you a lot.